People all over the world are now being affected by the impact of the coronavirus disease, COVID-19. As the infection continues to spread, WHO recommends that all laboratory-confirmed cases be isolated and cared for in a healthcare facility where possible. People suspected of being exposed to the virus can self-quarantine at home. Others who are experiencing mild symptoms of the disease but cannot go to a healthcare facility may also receive care at home with the support of family members. If you are experiencing mild symptoms, such as fever and dry cough, without having underlying health conditions, communicate with your physician and discuss if you can manage your symptoms while isolating yourself at home. Wear a medical mask as much as possible. If you cannot tolerate wearing a mask, then cover your mouth and nose with a disposable tissue when you sneeze or cough, and dispose of it properly. If you use a handkerchief, wash it after use. If you need someone to care for you, then assign one person who is in good health and has no underlying chronic conditions. Caregivers looking after patients should also wear tightly fitted medical masks that cover their mouth and nose. If secretions contaminate the mask, it should be replaced immediately with a new one. When removing your mask, do not touch the front. Discard the mask immediately after use and wash your hands. Do not reuse a mask or gloves. Stay at least 1 meter away from other household members, especially the elderly and people with underlying health conditions, as they are at higher risk for more serious complications from COVID-19 and need to be protected. Visitors should not be allowed until you are completely recovered. Limit your movement at home. To avoid sharing spaces with other members of your household, ensure that shared spaces, such as the living room, dining room, kitchen and bathroom, are well ventilated. Sleep and stay in a separate room. If that is not possible, try to maintain a distance of at least 1 meter from other people in the house. Wash your hands with soap and water often. Wash your hands also before and after preparing food, before eating, after using the toilet, and whenever your hands look dirty. If your hands are not visibly dirty, you can use an alcohol-based hand rub. Use paper towels to dry your hands after washing, and dispose of these properly in a closed bin. Otherwise, use a cloth towel, but ensure that it is not shared with other people and is washed regularly after use. Do not share eating utensils or linen, and always clean well with soap and water before reusing. Tables, bed frames, furniture, doorknobs, and frequently touched surfaces in all rooms must be regularly cleaned. All surfaces must be rinsed with soap or detergent before applying disinfectant containing 0.1% of sodium hypochlorite. Clothes and towels should be hand washed with detergent and hot water, or machine wash them at 60 to 90 Celsius. Do not share toothbrushes, toothpaste, eating utensils, dishes, cups, towels, washcloths, or bed linen. Do not smoke, as smoking can increase your risk of developing serious disease when you are infected with COVID-19. If you develop more severe symptoms, such as shortness of breath or chest pain, contact your healthcare provider to seek medical support. During these difficult times, do stay active and socially engaged. Maintain a healthy lifestyle by eating properly, sleeping well and exercising regularly. It is normal to feel sad, stressed, confused, scared, or angry during a crisis, so talk to people you trust. You can stay connected with your friends, family and colleagues through telephone, email, social media and video conferencing. Get your information about COVID-19 only from trusted sources, such as WHO and your national health authorities.